Today we are discussing necrotizing fasciitis.
Let's start by talking about the integumentary system. Some functions of the integumentary system include protection, such as it being the first barrier to pathogens and protecting internal organs from physical damage, dehydration, and environmental hazards. Another function of the integumentary system is the regulation of blood temperature. Fat helps retain heat, while blood vessels constrict to conserve heat and dilate to promote heat loss. It is also responsible for sensation. Sensory receptors detect temperature change and pain. Finally, it is responsible for waste removal. Some waste, such as salts and urea, leave through the sweat glands. The hypodermis, or subcutaneous layer, contains blood vessels, nerves, and adipose loose connective tissue. It connects the dermis and epidermis to the underlying muscle tissues and stores fat as energy. Because of its loose connective tissue and blood supply, infections like necrotizing fasciitis can spread rapidly through this layer.
So what is necrotizing fasciitis? It is a severe soft tissue bacterial infection that causes the decaying of the fascia, which is the subcutaneous tissue surrounding the muscle. Necrotizing means something that causes the decay or death of a tissue. Fasciitis means inflammation of the fascia. There are two types of necrotizing fasciitis. Type 1 being polymicrobial. That means that there is multiple bacteria. Type 2 is monomicrobial. This is a single bacteria and most commonly strep A.
Who is affected and what are the risks? It can start from something as minor as a cut, bruise, or even blunt force trauma to the skin or mucous membranes. There is a greater risk for people with unmanaged diabetes, alcohol use disorder, immune system or vascular system problems, cancer, pregnancy, kidney disease, cirrhosis of the liver, and HIV. However, there is an estimated number of only 0.3 to 15 cases per 100,000 people per year.
Next, we'll talk about the causes and symptoms of necrotizing fasciitis. It is often mistaken for flu or skin irritation due to early symptoms such as fever, sore throat, stomach ache, nausea, diarrhea, chills, and body aches. However, the infection point is usually red and tender, spreading as rapidly as 1 inch per hour. Advanced symptoms are high fever or hypothermia, purple or mottling rash, and possibly a rash of blisters. The pain is excruciating at first, but it improves as the nerves die.
How is it diagnosed and treated? Doctors perform diagnostic tests such as a physical exam, ultrasound, X-ray, CT scan, blood test, or skin tissue biopsy. However, the best way to confirm is through exploratory surgery. Once the doctors open the patient up and confirm the diagnosis, they drain the sore and debride the dead tissue, leaving the wound open post-surgery. This is because it is common for them to perform multiple debridements over a few days. In conjunction with surgery, antibiotics, immunoglobulins, and hyperbaric oxygen therapy may also be prescribed for better results.
What is the prognosis and potential complications? The prognosis depends on overall health of the patient, the speed of the diagnosis and treatment, the type of bacteria that caused the infection, how quickly the infection spread, and how well the treatment actually worked. Even with treatment, some studies suggest that there is a 25 to 33% chance of mortality, underscoring the seriousness of necrotizing fasciitis. Complications of the infection can be toxic shock syndrome, organ failure or death, sepsis, scarring, amputation, disfigurement, loss of the use of limbs, and or gangrene.
Close. We will answer some frequently asked questions. How can you prevent necrotizing fasciitis? Well, to start, you should avoid cuts, burns, scratches, or bug bites. If you have a wound, clean it and cover it up until it's healed. You should always keep your hands clean and bacteria-free. It is also important to avoid swimming of any kind if you have a wound. When should you see a healthcare provider? It is crucial to seek medical attention if you notice the following: discoloration and swelling that increases in size rapidly, you're in a lot of pain, and/or you develop a fever. Remember, early intervention can significantly improve the outcome. If you have already been diagnosed and treated, it is important to attend follow-up appointments and take antibiotics as prescribed.
We hope you enjoyed our information session.